They didn't believe it. And well, what's to believe when you see an X-ray? When you see the normal thigh? When you see the man is up and about and functioning without pain? No, it doesn't exist, therefore we don't believe it. Okay? So what are we going to do with people like that? Are these doctors? Are they scientists? We get other things too. I had a lady who came back to the hospital and she wanted to pick up some of the enzymes and minerals that she was taking. And she says, "Hello, Charlotte." And I must admit that we've had several thousand patients and I do not remember everybody. So she said, "You don't remember me. I was at the hospital 3.5 years ago. I had breast cancer and liver metastases." That in itself is an interesting statement. Once there's cancer in the liver, with orthodox treatment, you have 3 to 6 months to live, period. That's it, and there is no recovery from cancer in the liver, okay? So 3.5 years, she tells me, she had cancer in the liver. I said, "Well, I'm very happy, and I'm glad you're doing well. What did your doctor say?" Now, when a doctor sees something unusual like that, if he were a true scientist, wouldn't he be interested to say, "What did you do?" No, no. What did her doctor say? "Well, whatever you're doing, keep doing it. It's doing you good. But don't bother me with it, right?" He didn't want to know. Unfortunately, of course, it's not entirely his fault. There are laws. The law in California says any physician who treats cancer with anything but radiation, surgery, or chemotherapy is a felon, goes to jail, loses his license, and pays a $10,000 fine, so he can't do anything with it. Even if he knows. There are laws against healing cancer. The law now says, if, for instance, a patient has cancer, has been treated with surgery, radiation, and chemo, and is failing and dying, the doctor is not allowed to try anything else. He must use only those treatments that have already proven to be failures. Which means the state now requires you to die, and that's unconstitutional. I do not believe that if that law were ever tested that it would stand up. But the powers, the chemotherapy and medical pharmaceutical powers with their billions behind them, keep this kind of thing going, and you and I don't have the kind of money to fight it. They can keep us in court for years. We don't have that kind of money. We can't pay for the lawyers. Okay? So the law stands, and you have to die because that's what the chemotherapy, chemical pharmaceutical trust is saying. It's very bad. Besides, not just in California, there are other states that have similar or the same laws. Why do you think we have to function in Mexico? That's the reason. If you want to heal, you can't do it in the U.S. Now, healing is very special. Healing, in my book, is not cutting out a bunch and cutting out a tumor, is not radiating a damaged area. Healing is not dealing with a symptom, which will just come back. Healing is not giving a drug that causes damage and causes new disease. If you take a drug for high blood pressure for long enough, you're going to get new problems. Then you get kidney problems, and you have a drug for the kidney, Lasix or something like that. And that causes your potassium to be lost. Then you have to take other drugs. Pretty soon you're on a list of drugs this long, and you haven't gotten rid of the disease. You just got new diseases because of the drug damage. That, in my book, is not healing. Healing is totally restoring all the underlying systems. Is restoring the kidneys and the liver and the essential organs, the spleen and the lungs and the heart and the brain. Everything needs to be fully restored and function well. Then the body will heal. And as Dr. Gerson said, the body's own healing mechanism works again. And whether you are healing bones or you're healing infections, or whether you are healing old chronic hepatitis or Epstein-Barr or this so-called chronic fatigue syndrome, or whether you are healing lupus or anything else, or cancer or diabetes, makes no difference. And that's where, of course, we clash with orthodox medicine. They say, "What do you mean? One treatment for every disease? That's quackery." That's very difficult. It takes the basic understanding, and that they haven't got. Doctors in medical school do not have courses in biochemistry, and that's where we're dealing, the underlying biochemistry of the whole body. And we have to address all the systems. And we don't just push a little here and shove a little there. We work with the immune system, the enzyme system, the hormone system. We work with the minerals. We work with the digestion. We work with the detoxifying. Every part of the body has to be restored and reactivated so that you can truly heal. But that's what we do. And that's where we have these healed patients. And it doesn't matter of what disease. Unfortunately, we haven't been able to get too many people to come here today. We have only 2 recovered patients we'll be showing you. But these 52, that's not the only ones we have. We have hundreds and hundreds of terminally ill, so-called incurable patients that are not living a few extra months, that are recovered for years. And the way they got into these lists is because they're exceptionally well documented, unquestionable, because they're well and recovered for at least 3 years or more. We don't want to take the patients who are only better for 3 or 6 months. Then the orthodox, well, we can do that too. Of course, fine. But we have the total recoveries, 3, 4, 6, 8 years. And we have, from Dr. Gerson's book, okay, he says a cancer therapy results of 50 cases. Now he said, and we still say today, the bottom line is the only thing that counts. Does the patient get well and stay well in good, normal, functioning, active life? Okay? Now, of these 50 patients that he showed, there were a number that were young enough. Now, the book was written in 58. Father died in 59. There were a number that were young enough in 58 to be alive today, and they are. These were terminally ill patients. And we have been able to find at least a dozen of those that were young enough alive and well today, in active life, busy and working and fine. One of the patients who had terminal melanoma at the time, her husband said she had at most 3 months to live. And that was in 1942 or 3. 46, I don't remember the exact number. She came to the clinic just a month ago. She as well. She came to the hospital because her daughter-in-law has cancer. She is 74 and well, active and looking well and busy and with her family and her grandchildren, okay, in good condition. After 45 years, that's healing. That's not cutting out a piece or a symptom or a lump. That's healing, because she was given 3 months to live at that time. And many of these patients are still alive, and we are still finding some of Dr. Gerson's patients who were not in the book, because in order to get in the book, they've had to be well at least 4 or 5 years. And there were others that were well a little shorter time. My father was, at the time he died, he was preparing another book with 100 more cases. Well, of those, we still find a whole bunch that are alive and well. True healing, getting to the underlying problem, healing not only the cancer, but all the other problems that do occur in many patients, and many other diseases. That's true healing. And that's where the Gerson therapy cannot be equaled. And I do unfortunately have to say, for instance, in many cases, Laetrile can be helpful. You may have heard of Laetrile. Laetrile helps the body fight tumor tissue, but it doesn't restore the liver and the kidneys and the immune system. And when you stop the Laetrile, the cancer keeps right on going and you die. That's not healing. We can use Laetrile, we do sometimes. It can be a help. It can help to destroy malignant tissue, but it doesn't restore and heal the body. It doesn't overcome the high blood pressure and the kidney disease and all the other problems that these patients suffer from, because it specifically attacks tumor tissue. Well, good. And as long as it's non-toxic, yes, we'll use it. But it doesn't heal, meaning restore, rebuild, reactivate. And that's the key. And for that, you have to reach the underlying problems. In the underlying